Back now on Triad today, and we have a very lovely first-time visitor to the show. We're so glad she could be with us. Aerika Hutchens is physician assistant for Northern Cardiology, part of the Northern Regional Hospital family. We welcome you to Triad today. Good to see you.
Good to see you.
I'm going to start out on a personal question, and then we're going to talk about heart disease and things like that. But who or what led you to a career in healthcare? I'm just curious. Was there a doctor or a nurse in the family, or what?
Actually, no. I have no medical folks in my family, but I volunteered at Northern Hospital when I was in high school. So,
okay.
They like a candy striper, right? So I did that, and I actually thought I wanted to be a news anchor.
A news anchor?
Yeah.
So you'd be sitting here, and I'd be over there as a candy striper.
Yeah. We'd be trading spots.
Right.
But I just had a change of heart when I was in college and thought I should pursue medicine. And
now, where is Northern Cardiology located, and what area do you serve?
So it's very close to the hospital, 708 South Street.
Okay.
And we serve Mount Airy. We have some folks from Pilot. We have a lot of patients from the Virginia area as well.
And when people see a title on screen, like yours, Aerika Hutchens, and it'll say physician assistant.
Yeah.
And some people still will ask me, they say, well, what exactly would a physician assistant do in a cardiology practice? How do you answer that?
So my typical day right now is seeing patients, typically 8:30 to 5. So I treat all ailments that someone can come in with. I have Dr. Below, who I work with, and he sees folks too, and we sometimes go in together to see patients. He spends most of his morning at the hospital doing stress tests and consulting on patients. So
right.
We have a presence in the hospital and in our clinic.
Yeah, so when you mention some of the elements or reasons, give me an example of a couple of things that people will typically come in complaining of or need help with.
Yeah, so there's a lot of things people come in with. Shortness of breath can be a heart-related problem. Of course, chest pain is a bread and butter cardiology problem. We have palpitations, fluttering sensations of the heart, leg swelling can even be a cardiology issue. So,
what kind of diagnostics can you offer or suggest to patients when they have some of these conditions coming in? What kind of diagnostics can really sort of help nail down what the problem is?
Yeah, we like to get an EKG on our folks. That really shows us the conduction system of the heart, what makes the heart contract. Other images we will get are stress tests. So that shows us how well the heart gets blood under exertion. So coronary artery disease, right? Blockages in the vessels. And another good image that we get at our clinic is ultrasounds. The ultrasounds of the heart show us structural heart disease, right? Whether it's heart valves, how well the heart muscle moves, or even how well it pumps out blood, along with a lot of other things. But those are the three biggies.
Right. Now, and I'm assuming that you can do all this right in your office, the EKG and the stress test and all that?
So we do EKGs in office. We even do treadmills in the office. But sometimes we can order a nuclear image with treadmills, and we'll do that at the hospital. It's outpatient.
Which is just a couple steps away from the office.
Yeah.
What are some things that we can do? I want you to give me some advice on how to prevent heart disease. So just off the top of your head, talk to me about things that people can do to be heart healthy and to prevent heart disease.
Okay, this is how I like to end my visits, is talking about how we can prevent things from occurring to us. Of course, controlling blood pressure is a huge risk factor of having heart disease. So having good blood pressure, checking it, a few times a week is what I tell my folks to do. Not to smoke, that's a big one.
No smoking.
Yeah.
Which is difficult to tell patients, I guess, in this area because we are a tobacco state.
It's
but
true.
You tell your patients, don't smoke.
Yeah, I tell them I can only imagine how hard it is, but it will be helpful for your body.
Right.
Having a good lifestyle, having a good diet. I tell folks, I don't want you to go on a diet. I would just like for you to have a good diet, you know. And walking, that's great exercise, things like that. Yeah.
And that's what you say at the end of the visit,
which
is appropriate because this is the end of our visit, and you're telling me these things. Up on screen, choosenorthern.org is the general website for the hospital, or to make an appointment at Aerika's office at Northern Cardiology, you can call 786-6146. It was a delight to have you. Thanks for choosing this field, and I think you're just a great PA, and we appreciate your time.
Thank you.
All right. We'll be right back after this.